but let's get started. So everybody, I appreciate you joining on a Thursday afternoon. Well, for Dr. Mary, it's a Thursday morning. So again, this is the Art of Mindful Medicine, episode 18. I am Dr. Seth Gilson, biological dentist, certified yoga teacher, speaker, and personal coach. And my very, very special guest today is Dr. Mary Pardee, and she is a naturopathic medical doctor and a certified functional medicine doctor who specializes in integrative gastroenterology and hormone balancing in Los Angeles, California. She is the founder of Modern Med, that's MODRN Med, a telemedicine and virtual wellness company that provides medical and health services to clients across the world from the comfort of their homes. That's pretty sweet. Dr. Mary is also a board member for Our Academy Global, an organization whose mission is to provide opportunity to homeless and ex-felons with a holistic 360 approach. Dr. Mary, I really appreciate you coming on here. I really appreciate your time. And just please introduce yourself briefly to everybody and we'll get started.
Awesome. Thank you for having me on. I'm excited. So I'm based in LA. You gave me a nice little intro there, but I specialize in gut health and hormone balancing for men and women. And I love kind of educating people more so than anything. So I'm excited to chat about it more with you.
Awesome. So as I said before, I always like to start with gratitude. So if you could please share with us 3 things that you are grateful for today.
Absolutely. I like this. 3 things I'm grateful for today. Going to be talking to you. I love this more than anything. I love just talking about health, wellness, things that I'm passionate about. And I'm so grateful that we have the platform to do that today. Other thing that I'm grateful for is going to be family and friends. I'm connecting with some individuals this weekend, which I'm really excited about just because of the pandemic and the lack of social connection that we've been having. And lastly, I'm thankful for where I live. So it's going to be a beautiful day in Southern California today. And I like the sunshine and getting out in nature.
Absolutely. I'm with you on that one. I can't say the same for South Florida. It has been raining for 3 days straight. Or actually, it stopped raining. I actually got to run this morning, but for Monday through Wednesday, it did not stop raining. So, but other than that, I do love the weather here and in California. So, I appreciate the gratitude. That those are 3 beautiful things. And yes, I know there's a lot of us really lacking that personal in-person connection that we normally get to have. So good for you. I'm really happy to hear that you're getting to go and do that this weekend. So if you could please tell us a little bit about your personal story, your life growing up, things like that. Where are you from? What did you like to do as a kid? Things like that.
Yeah, so I grew up right outside of Boston in Massachusetts. I'm an East Coaster as well. And I grew up in the suburbs, so had a lot of land to run around and play in. Was always out in nature, love the trees and the mountains and streams and all of that, getting my hands dirty in the soil. And I grew up riding horses as well. And my health journey started as a really young girl. So I had constipation, bloating, abdominal discomfort, migraines, reflux pretty much my entire life. And it was at a really young age when I started to go to a lot of doctors to figure out what was going on with my gut, why I didn't feel well all the time. And I went to mostly conventional doctors in the beginning, had a colonoscopy at a really young age, endoscopy, everything was normal.
Wow.
Diagnosed with IBS and still just did not feel well. And finally, I got into this doctor's office and he looked at my chart, which was much thicker than it should be for, a young woman. And he said, I've seen you've gone to a lot of doctors. There's no more answers for you. You've tried all the medications and the medications, some of them may have helped in the beginning, but then left me with more side effects or the same amount of side effects as they helped. So it was like just switching one problem for the next for me personally. And he's like, you've tried all the meds that we have. You're just going to have to live with it. It's IBS. It's not that big of a deal. It's not life-threatening. And there's nothing else we can do for you. And I left that appointment in tears. And I remember leaving it feeling like I never want somebody else to have to leave an appointment with this feeling of hopelessness, that nobody has any more answers for you. There's nothing else that you can do, that you just have to live with it. And so from that point, it was really about me becoming the doctor that I didn't have as a young girl, and really wanting to be able to educate people, to continue to give them options, resources. and a different perspective on health, treating it from the root cause versus just a symptomatic treatment approach, which really is what naturopathic and functional medicine do, is we look at why do you have these symptoms? What is the root cause? And dealing with health issues from that perspective.
Awesome. Awesome. Thank you. Thank you for that. It was a very nice rundown. So I want to go back to a little bit more about you growing up, and who would you say is the most influential person in your life when you were growing up, and why?
Yeah, my parents for sure. They are extremely hardworking, passionate. They have a wonderful relationship. So they're definitely my role models in terms of who I looked up to and still look up to these days as well.
Beautiful. Do they still live on the East Coast, or are they out with you on the West Coast?
They're on the East Coast. Yeah,
Nice.
I have a huge family. So there's usually about 50-ish of us at Thanksgiving, and this year is going to be different, obviously.
Yeah.
But we have a big family on the East Coast.
Awesome. That's beautiful. And also from growing up, what would you say is the most impactful memory you have from your childhood?
Oh, you cut out for a second. Impactful.
What would you say is your most impactful memory from your childhood?
Oh, that's a good question. Most impactful memory from childhood.
I mean, besides the one you already said, I mean, walking out of the doctor's office like that is, I mean,
Yeah.
that's
Yeah, I think it's a combination. I'm going to say two. One of them would be just the trip. So we would go sailing as a family, and having that much togetherness time. I don't think I appreciated it at that age. And now I look back so appreciative that my parents were able to provide me with a vacation, and not just a vacation, but like an amazing vacation where we got to see the world.
yeah,
So little bits of those vacations. And then the other piece is the ability to grow up with tons of land. I live in Southern California now, and I grew up on multiple acres of land where we could go run around in the fields, get lost in the woods, play in the streams. And not a lot of people have that in Southern California, at least in LA proper. So I'm super grateful for those memories of just being in nature. And that's really where I see myself moving back to nature in some aspect from Los Angeles.
beautiful, awesome. That's fantastic, and I totally agree with you. I think having those experiences, just being in nature and being with family, are two. I mean, I think they're the two most, especially psychologically, growing up and psycho-emotionally, it's the most influential aspects growing up, being in nature and being with family, and then doing them together. So,
Yeah, priceless for sure. Did you get to have where did you grow up?
I grew up in South Florida. So my parents don't have acres of land. We have a little under an acre. So we have a little oasis back there. But I obviously had friends in the area that, I don't know if you know much about South Florida, but Davie is a little bit more of a country type, and there's acres of lands there and farmland and things like that. So I got to hang out with some of my friends in those areas. So that was always fun. And then we did get to go on vacations. My parents were fans of cruises and things like that, so I got to see the world through through traveling the oceans and stuff like that. It was a lot of fun.
Yeah, that's amazing.
Yeah. So what would you say is the most significant lesson that helped you overcome adversity throughout your life so far?
One of my favorite books is You Are the Placebo by Joe Dispenza. And my clients and patients know this because I give it to every single patient as a recommendation. And the reason behind that is because my own healing journey. And it was one of the most pivotal moments in my life when I really realized that your thoughts and beliefs influence your physical health just as much as your environment, the people you surround yourself with, the things that you put into your body, nutrition, diet. We have to keep in mind that physical health is not just about supplements or medications or exercise. It's about everything. It's about mental, emotional, spiritual well-being as well. And so for me, that was the missing piece. And I think everybody's healing journey is different, but for me, I was into nutrition at a really young age, and I was eating super healthy, and I was exercising, and I was doing a lot of the things that we consider foundations of health. But for me, the mindset piece was the last piece to be put into place. And not that I'm complete now, because it's always a continuous journey. But for me, that was the piece where I was like, your thoughts don't impact your health. Like that has nothing to do with how your gut functions or your hormones and things like that. And when I, started to get into Joe Dispenza's work, Tony Robbins, Jim Rohn, like all of these influential people, it was at that point where I realized my mindset needed a huge shift. I couldn't continue to think of myself as, somebody who was sick. I needed to shift into a health mindset so that my body could then follow suit. And it really was at that point when I was able to start to shift my mindset, really go into self-care, relaxation things, realize that I was super stressed, all of those pieces where I started to see my gut health shift for the long term. And without that, I don't think I would be where I am today in terms of my gut being completely healed.
Beautiful. That's fantastic. And I imagine all of this was part of the inspiration that led to you to becoming a doctor. What was that journey like for you?
Yeah. Yeah. And I think it's, you pick up things along the way. So a lot of the mindset stuff that I did was in the beginning of medical school. So, I was really on the path of it's all about nutrition, it's all about exercise, it's all about supplements, all about this. And then I was like, oh gosh, I'm missing like this whole mental, emotional, spiritual world. And so I've got a lot more to learn.
Of course. Yeah.
And I guarantee in 10 years, I'm going to be like, whoa, I was missing this whole whatever it is. And I think that's the most important thing about being a doctor is that you are humble enough to know that you know nothing. And the more that I know, the more that I realize there's so much more to know. And I'm so excited to learn from elders, mentors, other doctors in terms of gathering as much information to help my patients.
Yeah, absolutely. I think that awareness of self is extremely important and unfortunately really rare as we're growing up and even in school. I think a lot more of that needs to be incorporated and that's part of what I'm doing with this platform, wanting to get that awareness and knowledge out there for people. So I appreciate you saying that. So in the work that you do now, what would you say are the moments that bring you the most fulfillment and joy?
In the work, so in career context, there's nothing better than getting on a call or seeing a patient, whether it's in person or Zoom these days, and really hearing how they've implemented the suggestions and the knowledge that you were able to give them and to see their health totally change. And that's like the most special piece of what I do. And it's also seeing like the light bulb go on with people and seeing that, they read Joe Dispenza's book and they're 60% better just from reading the book. And I'm like, we didn't do a single supplement. We didn't do a medication. And we can get a 60% improvement with just reading a book and changing mindset. So those things are really special for me. And then the other thing is diving in and finding root causes for people. And I think that this is an area of functional medicine where people get really hung up on finding one root cause. And in reality, it's several. It's multifactorial. You're going to find deficiencies here. You're going to find traumas here. You're going to find, maybe it's motility issues or whatever physical things. But it's really explaining those to people and so that they feel like, wow, I kind of have an answer as to all the reasons why I may be experiencing the symptoms that I experience. Because I think it's important to understand those things and not just say, hey, you've got constipation, you take this, or hey, you've got loose stools and bloating, you take this. It's like, why do I have these things? And with that understanding and knowledge, you can make sure that the patient not only knows how to, eat dinner, but knows how to fish for themselves and can troubleshoot later on in life when you might not be there.
Yeah, it's just a whole new way of learning, and it's actually and I do this with patients. I mean, obviously to a different degree, because biological dentistry, we obviously have a little bit of a different focus, but teaching people how to think is really important. I mean, like you just gave the analogy. I mean, giving a man a fish, he'll eat for a day, but if you teach him how to fish, he can eat for a lifetime. I mean, that makes a massive difference in people understanding that a lifestyle change isn't, like you said, just one thing. It's multiple aspects of your life, and it's kind of like a domino effect. Once you kind of start to move in that direction, other aspects of your life really start to change. And just like you said, I mean, just the mindset. I mean, that affects how you view the world, and our perspective on the world is extremely unique to each of us. Of course, there's some overlap, but very unique to each one of us, and influences how we lead our lives. So that's very, very admirable, and I appreciate the work that you do very, very much.
Thank you. I'm right back at you.
Thank you. So I'm shifting a little bit into mindfulness, and I know this is something we talked about a little bit when we had our previous conversation. But what would you say does mindfulness mean to you?
Hmm. Mindfulness to me is being present and being aware about what's going on in your body and the things that you're experiencing from your perspective. And so when we take it from a functional integrative gastroenterology perspective, mindfulness is looking at your food before you eat. It's, actually knowing that you're eating in the first place. I think that a lot of us, in LA, you can drive down the street and people are eating. And I'm like, I don't even think that they know that they're eating. It's so autopilot and just getting from one point to the other, getting fuel into their body versus it being a ritual, being an experience, being a social experience as well, which I think is really important because we're designed to be social creatures. We're designed
Mm-hmm.
to eat together. We're designed to have joint experiences in a community setting. And a lot of this has shifted into this fast-paced lifestyle. And of course, we're going to be bloated. We're going to have indigestion. We're not going to be able to digest our food if we're inhaling on the 405 and not really thinking about what's even going into our body. So I
Absolutely.
talk about mindfulness all the time in terms of, yes, meditation and getting your practice in place, morning rituals and things like that. But also from a gut health perspective, mindful eating can change symptoms dramatically. I actually posted about this yesterday. We have a gut health course with one commune. And one of the biggest reviews that we got was the video on mindful eating was the most impactful. And it's also the only one, like, it doesn't require any supplements, any medication. It requires you to sit there and just be present with your food, chew it well, don't have distractions. Ideally, be talking to somebody, which slows you down. It allows you to take, space between bites. Making sure that you're chewing your food until it's baby food. And most of us are like swallowing whole pieces of steak, and our stomach is not meant for mechanical digestion. It's just chemical digestion. So
Yeah.
there's so many aspects of really being present with your food. About 30% of gastric acid and secretions are produced just with the sight
Yep.
and smell of food.
Yep. Right.
Even before it hits your mouth.
Yep.
It's like we digest a lot of our food just with our eyes, with our nose, and looking at it and preparing it and things like that. So if you're skipping that whole phase, that's 30%. So I think it can be so impactful for gut health specifically.
Yeah, absolutely. That's something I talk to my patients about how chewing your food, obviously sitting with it and realizing that you're about to eat a meal, and like you said, but fully chewing your food is not only extremely important for gut health, but it's for oral health too. I mean, it actually that's the mechanical process of chewing is actually very cleansing for your teeth and gums. So it's a very good point.
I love that. I just learned a fact. That's a good one.
Yeah.
That makes sense.
Yeah.
Yeah, you are responsible for the only mechanical digestion in our body, which
Yeah.
is awesome.
And
So
we should pay attention to that. I mean, the one part of digestion that we're responsible for, we should pay attention to, right? So, what are some ways that you incorporate mindfulness in your life, and how do you feel that this has been a benefit to you?
yeah, I'm a big fan of mindfulness meditation. I go for a morning walk every morning, and part of that is just looking at the ocean, looking at the trees, looking at the birds. I'm very much just in a parasympathetic state for that morning walk. I try to do an afternoon walk as well. I'm a big walker in general.
Awesome.
I think walking is one of the things that we don't tap into enough in terms of biohacking and just really relaxing our central nervous system. And then other ways mindfulness plays a role in my life is just being present with friends, trying to put cell phones away. My friends know me as the cell phone stealer, and I put them in a box. If we're on vacation, I'm like, no cell phones. Like, let's not be, sorry, Instagram, but on social media all the time. Let's be really present with the people when we're with them.
Yeah, I totally agree with that. I think that's beautiful, especially when we're away somewhere. I mean, I like to go away places where you can't even get signal, so you can't, even if you want it, you can't even get it. I think that's a great practice, and some things that everybody should definitely take note of. How do you introduce mindfulness to your patients, especially when the topic is so foreign to some people?
Yeah, and it's kind of what I just did in terms of talking to people about how something like mindfulness that is in the mind, in your body, relates to physical health. People are coming to me not for mindfulness. People are coming to me for constipation, bloating, lack of a period, whatever it is. And so I have to take the physical symptom and relate it to stress, the central nervous system, how the vagus nerve innervates your entire GI tract, and really explain to them how this mindset piece is going to affect their physical health. And I think that once people understand the impact of your brain and your thoughts and, your parasympathetic, sympathetic nervous system balance on your physical health, it becomes really obvious as to why we need to implement it. Our ancestors already had mindfulness built in. They did not have to go sit and meditate. They were walking and foraging for food. And when you forage for food, what happens? Your eyes are moving from one area to the next, which is EMDR,
Mm-hmm.
right? So you're having these eye movements that are actually putting you more into the parasympathetic nervous system, and you're in nature, which we know already drops you down into a different mental state and increases endorphins and changes your whole biochemistry just being outside. So the fact that we are not living in an environment that we were designed to live in, we have to implement it in other ways and be more methodical and intentional about putting mindfulness in. And so that's really what I try to tell people, is that humans, our DNA hasn't changed to evolve to live in apartments, to live by ourselves, to be out of community, to not be around, this fire circle every night eating together. So
Mm-hmm.
we have to be so intentional about putting pieces in that help to calm our nervous system down and bring us back to where we're really naturally designed to be.
Yeah, I think that's a big part that a lot of people are missing. Even before everything that's going on, people just kind of didn't commune together and eat together and really intentionally sit and be together, really be present with one another. I think that's extremely important. And you were talking about some different ways that you teach people mindful practices. Other than eating, like we just spoke about, what are some other practices that you show or give people? And like you said, walking is another one.
Yeah. So walking, I'm asking everybody, how many steps are you walking per day? Because we can track that now. And so making sure you're getting 10 to 12,000 steps per day, I think is huge. I'm actually on a walking treadmill as we speak. I'm not walking because it would be distracting, but that really helps to induce some of the mindfulness as
Mm-hmm.
well. And then the other thing that I talk to people about is heart rate variability training. And I think that can be a really nice entry point into meditation because it's much more guided. So we use the Inner Balance device by HeartMath, and HeartMath is one of the leading institutions for HRV training. And this device, it gives you more visuals and has you follow them with your eyes and pairs your breathing with it.
Oh
And
wow.
that's really where we see improvements in our HRV, is regulated breathing. And so then you can get feedback from it, which is nice. So it's a biofeedback device. So you get a score at the end, you get a heart coherence score. You also get an achievement score, meaning how many minutes you put in. So I think it's a really nice beginner's device and advanced. I still use it myself. I think it's phenomenal. And so that's one option for people, because I think when you're competitive like me, you want to score, you want to have something that's bringing you to it until you find the reward that it reaps, which you only can feel in mindfulness after several weeks of doing it,
Yeah.
right? So sometimes you don't experience like, oh, this was wonderful, I'm going to do it every single day. Sometimes you have to have something that's bringing you back to it.
Mm-hmm.
And then also I'll give people the option of, do you want to use something like the Calm app, or, there's tons of meditation apps out there. And I think it's finding something that really the people relate to themselves. And for me, it's going to be different than it is for you and for somebody else. Transcendental meditation can be super powerful, having a mantra that you repeat over and over. But I think it's going to be to the individual. So I think my job is to give them all of the tools, and then they find something that works for them.
Yeah, no, that's beautiful. I think that those are all great examples of just intentional, focused attention. And I mean, anything like, for example, walking. And I mean, for me growing up, I didn't know this is what I was doing, but exercising mindfully. I mean, because when you are focused on, I played soccer, but when you're focused on whether it's walking, running, biking, I mean, you're fully present in that moment. I mean, if you're not, you're going to either fall off the treadmill or trip on something when you're running. So, I mean, any activity for the individual that really makes them present, I think is a really good activity.
Yeah, we talk about that too, because you can get increases in BDNF, brain-derived neurotropic factor, which creates new neuronal connections for things like surfing, skateboarding, things that like push you from a nervous system standpoint, but are also high intensity. And so I love downhill mountain biking, and that is complete flow state. So
Mm-hmm.
I'll give sometimes people the book Flow, and ask them to see, like, when does time disappear for you? Like, when are you not looking at your watch? When do you forget to eat because you're so in the zone?
Mm-hmm.
And that is mindfulness, like, exploded, right? And for me, it's adrenaline sports, and really things that you're gonna die if you don't look in front of you, because you're gonna go off the side of the cliff. But there's also much more calm things to do. People that love to draw, or even like do coloring book things
Mm-hmm.
that can put you into that mindfulness space where you're like, whoa, how did 3 hours go by and I've been gardening, or I've been painting, or I've been doing something.
Absolutely. Artists and writers, I mean, definitely get into that flow state when they go. I mean, there's a lot of documentation and I'm sure like YouTube channels and things of people talking about being in that flow state when they're drawing or painting, things like that, which is beautiful.
Mm-hmm.
So how would you say, or I guess go a little bit more in depth in how mindfulness overlaps with gut health?
Mm. It gets back to the fact that almost our entire digestive process is really wired on the parasympathetic nervous system. So you've got two branches of your autonomic nervous system. You've got your parasympathetic, which is rest and digest. And then you have your sympathetic, which is fight or flight.
Mm-hmm.
And it's a common misconception that parasympathetic is good and sympathetic is bad. Both of them are on all of the time. You want both of them there. You don't just want parasympathetic. You don't just want sympathetic. You want to be able to increase and decrease both of them appropriately.
Mm-hmm.
And this is why I love HRV training, right? Because HRV training is, by definition, your ability to have a flexible autonomic nervous system, to speed up your heart rate when there's a stressor, to slow it down when there's not. So, if we think about why animals in nature don't have ulcers, they don't have chronic diseases that we have, it's because their ability to respond to a stressor and then to shake it off and come back to neutral is so much better than humans. They can be chased by a lion, they're in sympathetic, they get out of the way, and then an hour later, they've shooken it off, literally forgot about it, and now they're eating and enjoying their life again. So that's the ability to go from complete sympathetic, like totally in that fight or flight mode, to parasympathetic, rest and digest. And so if you're able to really balance that nervous system, I think it's really important. But for the digestive piece of it, we want to be more in a parasympathetic state. So that comes from the mindful eating. That also just comes from your daily practices that help you to strengthen that ability to go from sympathetic to parasympathetic. So every time we meditate, we are bringing our brain back to center. So people that say, hey, I'm bad at meditation. Nobody's bad at meditation. Literally nobody is bad at meditation. If your mind is wandering, every time you're bringing it back to center is one repetition. It's like you went to the gym and you did 20 bicep curls. You wouldn't say that was a failure at the gym. You're like, I have to do 20 to see any improvement. Of course you had to do 20. You have to do your reps to see the output.
That's a great analogy.
So, yeah, I think it's something that's more tangible for people, because I get it all the time. It's like, I can't meditate. Like, my brain does not let me meditate. I was like, that's meditating. You did it. Like, congratulations. And then there's different ways. There's a book called Bliss. It's by Light Watkins, and he talks about some things to like troubleshoot meditations with. But if you can understand the process of meditation more versus just thinking you sit there with your eyes closed and you're breathing, I think you can start to enjoy it a lot more as well.
Absolutely. I mean, being present with yourself. I mean, if you don't want to be around yourself in peace and quiet, then who else do you want to be around, right?
Mm-hmm.
So, shifting a little bit into kind of what you do now. So what would you say is the main focus of your medical practice currently?
Yeah, we're really gut focused. So most of our patients are coming to us with constipation, diarrhea, small intestinal bacterial overgrowth, inflammatory bowel disease, Crohn's, colitis, reflux. We do a lot of the functional bowel disorders is our real specialty. And then we do hormone balancing for men and women. And one of my favorite things to do with clients is more of a anti-aging, I like to call it longevity more so. Like you're gonna die. We can't anti-age, but but to make sure that your health span, meaning your quality of life
Mm-hmm.
while you're here, is really high. And that can equate to an elevated or a lengthened lifespan too, in terms of how many years you're on the planet for. But for me, the importance is health span almost over lifespan, because
Yeah.
you want your quality of life to be to the point where you can enjoy doing all the things that put you into the flow state, that allow you to connect to your community and to really enjoy your time here. And so I love diving into lab work with people, doing advanced lab testing, looking at advanced cardiac markers, metabolic markers. We're looking at the leading causes of death and saying what are the information that we truly know about leading causes and correlations with cardiovascular disease, dementia, accidental falls, things that we know are the main reasons why people die, and then saying, let's look at the labs where we know that they're correlated with a reduced risk or an elevated risk, and seeing how we can shift those labs for people. And then we're obviously always looking at, what are you eating? What are you doing for exercise? How many steps are you getting in per day? All of the foundations of health to make sure that they are doing as much as they can for their health span.
And so what would you say are some of the higher corollary markers, I guess, that for longevity purposes, and then also some of the ones that decrease longevity that you found from the research that you're talking about?
Yeah, so I'll just name a few, and these aren't in a specific order because I
Yeah.
didn't order them in my brain. But cardiovascular disease, leading cause of death. You want to look at markers that we know are correlated to either a reduced risk for cardiovascular disease or an increased risk, to make sure they're either high or low, right, respectively. And so for that, we know that omega-3 index, that's a lab that your conventional doctor will not run. Omega-3 index, when it's optimal, meaning 8 to 12% omega-3 index, has a 90% reduced risk for sudden cardiac death compared to a deficiency. So those are things where it's like, why wouldn't you run that to see where somebody's at? Because if you can get them into that great range, you can really reduce all-cause mortality from cardiovascular disease. Another marker which your conventional doc won't run is fasting insulin levels. So fasting insulin is really important for reducing the risk for diabetes,
Mm-hmm.
as well as pre-diabetes, which I think is just important because you don't want to get diabetes in the first place. And then we know that metabolic conditions and cardiovascular disease go hand in hand. So fasting insulin is the first marker that's going to increase before your HbA1c, which is your average blood sugar over the last 3 months, and before fasting glucose levels. So this is a marker that you can see trending upward before you even get the diagnosis of prediabetes.
Mm-hmm.
And that's what functional medicine and naturopathic medicine is about. It's about prevention. It's like, I don't want to treat you. I want to prevent the fact from ever needing to treat you. So when people come to see me when they're 25, 30, I'm like, awesome. Like,
Yeah.
your labs look great. Or, okay, your fasting insulin is at an 8. I don't like where it's trending. Let's make sure we get it down now so that you never have a prediabetes diagnosis in the first place. Other things for cardiovascular disease are going to be markers like Lp(a), which looks at coagulation and how sticky your blood can be, as well as things like ApoB or LDL particle number versus just a cholesterol panel.
Mm-hmm.
And these are more correlated with atherosclerosis and cardiovascular disease than just a typical cardiovascular panel.
Awesome, beautiful. And I mean, I'm definitely with you. I talk to people all the time about how preventative medicine is the way to go. I mean, you don't want reactive or medicine to be your staple. So talking a little bit more about your practice, and I know you're talking about naturopathic medicine and functional medicine, which is what you do. What separates modern medicine, your practice, from conventional medical practices?
Yeah, and that was a good example of it. So we're running lab work that may not be covered by insurance. So people should know that too. It's not like
Mm-hmm.
your doctor can run it and it's always going to be covered by insurance. But some of it will be. And so we're running advanced lab work to really dive into prevention. And we're also looking at different treatment options. So number one is we do different lab work. We go way more in depth in lab work than your conventional doctor would. And then we also have different options for treatment after we get the results back. And so we have a different therapeutic order, meaning that we start with lifestyle, mindset, all of those things before we even go to supplements. So if we can fix everything in your labs with nutrition, exercise, meditation, sleep optimization, then that's all that we need to do. The next rung is herbs, vitamins, minerals, right? So if we can do it naturally by supporting your body, by repleting things that are deficient, then that's our next step. After that, we'll then go to medications if we need them. So I'm not anti-medications. I think that there's a time and a place for them.
Mm-hmm.
Ideally, they're used acutely, meaning we have somebody with small intestinal bacterial overgrowth. We're giving them Xifaxan or neomycin antibiotics, 14 days, and then they're off of them. So, I think that medications can be really helpful. Antibiotics save millions of people's lives, right? So I'm not anti-medication. I'm anti-over-prescribing medications. And I think that there's a real distinction there. And then, there's surgery, which we don't do, but we can refer out if needed to. So we have a different order that we go down versus saying, hey, somebody comes in, they've got, prediabetes, diabetes, metformin. It's like, well, let's change your diet for a while if it's safe, like if everything's in a safe range. Let's change your diet, put in exercise. Let's give it a few weeks, few months, see what outcomes we have. And then we always have the option of pivoting if we need to.
Awesome. So it sounds like a much more highly personalized approach to what conventional medicine is doing right now. Like I said, proactive versus reactive.
Exactly. We treat the person. We don't treat the diagnosis as much. And I think that's really important because you can get two people that come in with similar symptoms, constipation. You run labs, one of them has small intestinal bacterial overgrowth, one of them shows signs of fungal overgrowth or just a motility disorder. You're going to treat all of those very differently. And that's where you're going to see better outcomes when you have an idea of what is actually causing the issue versus you all have constipation, Linzess. We're going to put you on this medication that helps with constipation for some people.
Yeah, exactly. For some people. So you're talking about gut health and SIBO and things like that. What would you say that you feel is the most significant chronic gut ailment in our society today? And do you feel that it's underdiagnosed or what's going on with that? In your experience anyways.
Yeah, so I'll say what comes to us the most because I'm guessing reflux, it's between reflux and IBS. So about 20% of the population, 15-20% have irritable bowel syndrome. It's reflux is the most common functional GI disorder, I believe. So it's between those two where they're actually similar in some ways.
That's what I was gonna say.
Reflux is going to be, or dyspepsia is things kind of sitting in the stomach, coming up, not going down. Irritable bowel also a lot of the times has a motility component to it. They also are both usually tied in with stress, making them worse. So, some of these functional bowel disorders that if you look at things, they don't really have anything wrong with the GI tract. In reflux, you may see gastritis or esophagitis, inflammation that's present. In IBS, you can scope people, meaning do an endoscopic upper GI and colonoscopy lower GI, and you're not going to see anything that's visibly wrong. However, the people definitely have symptoms. And so with these things, we need to dive deeper because it's not that we can see something that's an issue. Blood work is normal a lot of the times. So we have to dive deeper and say, okay, what's actually causing this change in motility that's exacerbating this person's symptoms?
Yeah, and I know you touched on some of the tests and things like that you do when it comes to cardiovascular disease. What are some of the things that or how would you first approach somebody that's like, I'm having this, and this, I don't know what's going on? Like, where do you start with somebody in that comes in like that?
Yeah. So we're doing similar tests that, a gastroenterologist would do in terms of we're doing blood work to look at thyroid function, but we're not just going to run a TSH. We're also going to run a free T3, free T4. We're going to run anti-TPO, anti-thyroglobulin antibodies. So we're going to do more extensive lab work, but make sure that there's not thyroid issues, changing motility. You don't have vitamin deficiencies like vitamin D, B12 that could indicate poor absorption of the GI tract. So we're doing a bunch of blood work. Sometimes we're doing stool analysis to see if there's any infection or inflammation, if calprotectin per se is elevated, things like that. And then the other tests that we're going to be doing a lot of the times are small intestinal bacterial overgrowth breath tests. And that's going to look for an elevated level of hydrogen production by different bacteria in your small intestines or methane production by methanogens. And you're supposed to have a lot of bacteria, but a lot of it should be in the colon, not a ton in the small intestine. So when you get an overgrowth of bacteria in the small intestines, you can have increased production of methane, hydrogen, or something called hydrogen sulfide now, which is a third gas that we're looking at. And these can change actual motility patterns. It can speed it up, causing diarrhea, can slow it down, causing constipation. And then also when you slow down or change motility, it can also cause reflux, which is why I was saying that those are related, because things then sit in the stomach and come up versus go down the way that they should. And so we're doing the small intestinal bacterial overgrowth test to look at that as a possible cause for IBS, not just stopping at the diagnosis of IBS and saying, you've got it. These are your options. And then we're also looking at small intestinal fungal overgrowth. About 26% of people with unexplained GI symptoms, which is pretty much the functional bowel disorders, have fungal overgrowth. It was found in one study. We don't have great tests yet to look at fungal overgrowth. Some of the stool tests will look at it. I haven't seen that be super accurate. There is an organic acids test you can do to look at the urine if there's any fungal metabolites in there. And then we also have questionnaires that we can ask people about possible fungal overgrowth symptoms. And then you can also treat empirically and say, let's be a detective. Let's see if you respond to a fungal treatment.
Mm-hmm. So I heard you talk about some of the tests that you do. There's a lot of these days, there's a lot of take-home things for people to do at home, whether it's like a take-home gut health test where you check your stool, or it's Smile Direct Club where they send you trays and you fix your teeth from home, which I don't recommend, by the way. But anyway, so what's your feeling on some of those take-home tests that they have for gut health and things?
Yeah, so the first one I'll talk about is the stool analysis, because I have an opinion about these. And so these are called comprehensive stool analysis, or CSAs. They're the ones that you can buy on your own. They get shipped to your house and you do a stool test and then you get the results. So it doesn't involve a doctor at all. And I think that there's a time and place for those, but I think it's a much smaller percentage of the time than we may think in the functional, integrative world. I'm always doing stool tests on people, say, with diarrhea, but I'm sending them to Quest. We're looking for like particular things that could be causing that. And the field of the microbiome right now isn't advanced enough for us to be looking at, say, 20 species and making suggestions based on those. We don't know enough about the bacteria yet to say this is causing this. It's more, possible correlation. There's not enough research for me to warrant those at this point. There are exceptions, and so I'm looking for parasites in people, things that can actually cause these symptoms. So I think that there are some exceptions, but to do a comprehensive stool analysis on every patient is usually not how I do things. So I think that you've got to be cautious on that. I also think that's where a functional medicine or a naturopathic doctor comes in place to be able to educate you and say, actually, this isn't going to give you the answers that you're looking for. Or, okay, if you have all the money in the world, we can do it, but let's also say that this is only a piece of the puzzle. And if we have to be conscious about finances, which most of us do, I'd rather spend your money, here. And so a lot of the direct-to-consumer testing, some of them can be really helpful. And so I think, there's tests now that you can do to look at your salivary cortisol level, your adrenals. You can get those shipped to your house. So I think that those can be helpful. But make sure that you have somebody that's helping you analyze them, or
Yeah,
the company is helping you analyze them. There has to be some implementation.
absolutely.
And it's really helpful to talk to somebody who can say, these are the best tests for you,
Hmm.
versus, oh, I'm going to go do a food sensitivity test because I have this. And it's like, well, food sensitivity tests have only been researched for irritable bowel syndrome right now, and you
Hmm.
don't have that. So maybe this isn't the best one for you.
Yeah, no, absolutely. That definitely makes sense to me. And thank you for sharing. What role do you feel that mental health plays in gut health? Because we're talking a lot about um, foods and symptoms and things like that. But and I know we touched on it a little bit earlier. But how influential is gut health really? I mean, mental health really with gut health.
I think it's huge. I think for some people, it could be 80 to 90% of their gut symptoms. I
Wow.
think for other people, it's, maybe 5 to 10%. So I think it's different for different people. When you have lifelong things, so when you have things that are starting in, childhood, teens, things like that, and you've had it for 30 years, almost 100% you're going to have a big portion being mental health, not because necessarily it was the original trigger, which it might have been, but because if you've been feeling this yucky for this long, it's going to affect your mood. It's going
Hmm.
to affect how you interact with the world. It's going to affect your social interactions. If you've got diarrhea for the last 20 years, you likely canceled events with friends. You didn't show up to dinners. You had to leave early. And so, whether it's the chicken or the egg, it's hard to say, because gut health is going to affect mental health, and mental health is going to affect gut health. But I do think it's a big piece of the puzzle for a lot of people that some people are ready to address and can see great results, and some people aren't ready to address yet. But either way, I think it's there, and it's important for clinicians to be talking about.
Yeah, I think it's a huge topic that I mean maybe we can get into another time in more depth, because it's I mean I know it gets very involved, and of course everybody's different, so it's a lot. But how I know the other thing that you do is your other focus is, like you said, hormone balancing for men and women. What are some of the things that you see with that, and what are some of the ways that you approach it, and how does the mental aspect of things affect the hormonal balance that we have in our body?
Yeah, yeah. So about 40% of men over the age of 45 have low testosterone. So that's pretty significant. And then not only that, but generationally, meaning each generation that comes up, our testosterone is decreasing. So
Wow.
we're seeing this shift in hormones in men, but you're seeing a shift in hormones for women as well. Where with the pandemic, we've had a huge shift in women's hormones. The amount of women that I've seen come in with amenorrhea, which is a lack or loss of a cycle, is on the rise for sure. And that's directly correlated to stress, having your environment totally change, going from working in the office to working at home, to also being the teacher of your children's school, homeschooling, trying to wear all of the hats. So hormonal shifts are really prevalent in both men and women. And it has a lot to do with mindset as well. So, you can bring that back as well. And then
Hmm.
I always love talking about relationship dynamics, because I think that's really important in hormones. And so the masculine feminine are polarities, and our hormones will respond to those polarities, whether we want to address it or not. And so if you are the masculine in your relationship, whether you're the female or the male, your hormones may start to shift based on that, versus the feminine being able to take time for yourself, be in the creative space. So I think that relationship and the polarity can also have an effect on hormones.
What are maybe some of the signs and symptoms that you've seen in people that there's that shift? Because when you're in a relationship, I mean, every relationship is different, right? And you might be the masculine in one and more of the feminine in another. How does those shifts in that I don't want to call it that in that balance, how does that, what are some of the things that people can experience when that's going on?
Yeah, one of the biggest ones is lack of libido,
Hmm.
right? So decreased desire for sex is one of the most common complaints I get. And there's so many causes. Is your testosterone low for either men or women? Is it that you don't feel comfortable in your relationship anymore? Is it that you don't have a polarity of masculine and feminine? Are you both in your masculine? That's going to affect libido as well. So a lot of these are physical symptoms, and people are coming to me like, hey, my tea has got to be in the, in the ground because I don't have any desire for sex. And then we check testosterone. It's like, your testosterone's 600. Like, there's no reason why you shouldn't have it. And so then you got to look elsewhere. You got to look at stress. You have to look at, do you actually enjoy your relationship still? That's a conversation that people don't want to have. Do you have, 3 kids, 2 of which are under the age of 4? That's a reason for low libido. Your body doesn't want to get pregnant if it's still trying to raise the young ones that you have. So some of them are normal, and then some of them can really be addressed by, doing relationship counseling or reevaluating your relationship or having discussions with your partner that are uncomfortable but necessary.
Yeah. So what would you say are some of that actual physical symptoms that people? I mean, other than low libido and things, are there other things that? I think the example you were giving was a male example. What are some of the things that women experience? Because
Yeah,
I think women
women,
are a little more sensitive when it comes to the hormone balances.
yeah, and women, we have a really nice trait about us, which is we have a physical manifestation of our cycles. Men don't have that canary in the coal mine. So I'm referring to women have a monthly period if you're in the premenopausal years. And when that period disappears, it tells us that something is going wrong. It also can tell us something if you have really painful periods. You're, curled up in a ball and you can't move, the first couple of days of your cycle because of cramps. If you have very heavy bleeding, if you have to change your tampon every hour for the first 3 days, or these are all physical manifestations of hormone imbalance. Premenstrual syndrome, if you have terrible outbursts of emotional, anger, irritability right before your cycle, a little bit is normal. So women are changeable. That's feminine energy. We're not supposed to be as stable. And I think there's a lot of beauty that can come from that. It's when things affect your daily life or affect your relationships or becoming a real issue. Then we want to address them and see, do you have estrogen dominance? Is estrogen too high in relative to progesterone, or do you not have any progesterone, or are your androgens too high, testosterone or DHEA, giving you irregular cycles or long or short cycles? So with women, it's easier to identify because we have more physical manifestations.
Mm-hmm.
With men, you're looking at less hormones that are less confusing, but also they don't have a period to lose, which would signify, hey, are you stressed out? They're not going to lose their cycle, where
Mm-hmm.
women have that to be able to be visible. But mood disturbances can be examples of hormonal issues. Women, progesterone is very calming to the nervous system. So if you have irritability, anxiety, we want to look at progesterone levels in your luteal phase, which is the last part of your menstrual cycle. And estrogen is great for skin health, and it provides lubrication vaginally. So is sex painful? There's so many things, but you want to look at all the possible causes of them.
No, awesome. Thank you so much. That is a fantastic rundown in just a couple minutes of what hormone imbalances kind of look like for men and women. And I definitely encourage everybody to reach out to Dr. Mary if you have any more questions or concerns about this. I mean, she's more than qualified, as you can tell, to go over all these things with you. And we have just a few minutes left, so I'm going to start wrapping up here. And first, I wanted to thank you so much for coming on here. I really, really appreciate it. And in closing, what I always ask my guests to do is if you could only share 3 things with people that they could start implementing immediately in their lives to improve their health, what would they be?
Okay. Number 1 is walk 10 to 12,000 steps per day. Hands down. If you're trying to get in these high intensity workouts, but you're not walking the 10 to 12,000 steps per day, I would just focus on that. That's for gut health, but overall health, longevity as well. Number 2 is increase your fiber intake so that you're getting 6 to 9 cups of vegetables per day, and ideally, 30 to 50 grams of fiber per day. So we're talking about a lot of vegetables. Our ancestors ate about 100 grams of fiber per day. Average American, less than 15 grams. So there's a huge discrepancy there. And that's to feed your microbiome to produce short chain fatty acids, things like butyrate, acetate, propionate, that are really going to help the entire health of your body, not just your gut. They talk to our brain, they talk to our liver, they regulate our metabolism. There's so many benefits of the gut microbiome.
100%.
So we've got number one, 10 to 12,000 steps. We've got 30 to 50 grams of fiber, or 6 to 9 cups of vegetables. And number three is community. And I think that this one is a huge one right now because of the pandemic, where social isolation is really, really common. But it's gathering with people that you love, whether it's on Zoom, whether it's in person safely, whatever it is, but talking to people that make you laugh, that increase your endorphins, and that make you feel loved and appreciated.
Yeah, I definitely agree with all three of those, especially the last one. I mean, I can't tell you how instrumental laughter is for our health. I mean, and have fun this weekend. I mean, laugh your asses off because, I think it was like a month ago, my girlfriend and we had some people over and we must have stayed up till, I don't know, 2, 3 o'clock in the morning, and everybody was just laughing and laughing, laughing. Like people the next day felt great from it, and they were saying that their abs were hurting from just all the laughing and things. And it's so important for people to do. And I think that community involvement is, like you were saying earlier, it's just instrumental for our health. So
Yeah.
I love all three of those. Thank you very, very much. Please give us a quick recap of your business, where you're located, any courses or projects or things that you have online for people to get in touch with you.
Yeah, absolutely. Thank you for having me. First of all, this was super fun. It was a different interview style than I've had before, so it was great.
Absolutely. Thank you very much.
Um,
So
yeah.
how could people reach out to you? What are some of the things that you're doing now?
Yeah, so Modern Med is my company. Our Instagram is at Modern Med, MODRNMED. Website, same thing, modernmed.com. We've got a gut health course that is with One Commune. It's 10 days of information. It goes through every, functional bowel disorder, as well as IBD, Crohn's, colitis, reflux, helminthic, like worm therapy. We talk about fecal transplants. We get into some really cool and interesting things there. So all of those, the link is in my bio and my Instagram as well. So either Instagram, website, but please DM me if anything pops up, any questions. I love to communicate with people.
Absolutely. And again, that's at Dr. Pardee, last name Pardee. And I appreciate you again, Dr. Mary, for coming on here. And everybody, I appreciate you taking your Thursday afternoon, whether it was a lunch break or whatever you're doing on this Thursday, or if you're not watching this live, I appreciate you taking the hour to listen to us and see what we have to talk about. I always welcome everybody's comments, feedback, suggestions. They're always welcome. You can check out all the episodes on my YouTube channel, The Art of Mindful Medicine. You can also check them out on my website, www.mindful.doctor. And of course, they're on my Instagram page at mindful.doctor. And we are on Instagram Live about twice a month. And I always will send out a notification and a message as to when the next episode is and who the next guest is. So please stay tuned for that, everybody. And as always, I end with a quote. And this is from Naomi Judd. And I think it's actually perfect for everything we were just talking about. Your body hears everything your mind says. So everybody, take a few moments to take that in and really pay a little bit closer attention to what you say to yourself. So again, thank you, Dr. Mary. Really, really appreciate you coming on here. Everybody, thank you again for your attention and have a fantastic day. And I will see you guys soon. And remember, stay awesome, stay mindful.
Thank you.
Thank you.